Have you heard the saying, time kills old deals? Well, let's talk about how that applies to the job search. I'm Dr. Hochman, the medical matchmaker. The most common reason that I see for job offers falling apart is time. When you wait too long to accept a job, or when if you're hiring, if you take too long to offer the job, often things fall apart. So, as a candidate, remember that the practice will be interviewing other physicians as well. And as a practice, remember the candidate is looking at other positions too. Now, this is a really tricky balance because the practice doesn't want to make an offer unless they feel confident that they can give you an offer that you really want and that you can be excited about. And I'm speaking mostly from the perspective of small physician owned private practices. That's who I work with the most. Um, and physicians, we get very bogged down in making the perfect decision. We have not had to really make all that many big life decisions in our life up until now. We may have ranked our medical school and ranked our residencies, but we just get matched to one. We do the rotations we're told to do. So making this big decision is not something we're used to and something we need a little bit more practice with. We also need to be okay with making the wrong decision. That's okay. I do talk in other videos about some of the ways to decide on a practice and some of the things to look at and how to look at salary. Those are all really important because you don't want to take a job that you won't be happy in, whether that's from a salary perspective or feeling supported or maybe an excessive patient load or work life balance. These are all really important things. And need to know your priorities. So, if there's a position that you really like, what I see a lot of, and this is mostly from new grads, but in every situation, is doctors will just see. I just want to see a little bit more of what's out there. I just want to interview at a few more places. And on the one hand, that's perfectly fine. You have to know what it is you're getting yourself into. But on the other hand, sometimes if you see something that's wonderful, you may just want to go for it. Um, Especially if it's something that doesn't come along very often. If it's a practice that will pay you a good salary, be supportive, support you as a physician, support you as a human being in your life outside of medicine. All of those things are so important. And, please, I beg of you, don't get bogged down with only a number, only salary, because there's a lot more to life than that. It is important. I understand we all have hundreds of thousands of dollars of student loan debt, but there is more to life than that. And if it takes us a few more years to retire, but we've enjoyed those years, well, that's a good thing. Um, so that's important. One of the ways that I really like to think about this is if you're in analysis paralysis, most likely you haven't done your homework for the years leading up to the job. And I'm going to give an example of how I bought my house, and then we'll apply that to medicine. So, my husband and I have been looking at open houses just for fun since before we even started dating. We, as friends, we would go into open houses and we would, just kind of see what's out there, and then dating and med school and residency and marriage and kids and all of that. So, we knew exactly what we wanted. When we first moved to the city we're in now, we were renting because we wanted to get a feel for the neighborhoods and see where we really wanted to end up. And we weren't quite looking for a house, but we happened to find a house that was exactly what we wanted, within reason. So for us, it was very important that our backyard is a forest. So as you can imagine, there aren't a lot of houses that have that. Now there's more here than there would be other cities, but we found a house that had a beautiful back deck on the forest, and for us, the rest of the house was nice, but the deck was really what we wanted. So we kind of made an impulse buy um, of the house that we live in. Now, that's a big impulse buy, but if you really think about it, we had been preparing for that impulse buy for, oh goodness, 15 years. So, yes, it was an impulse buy, but we knew what we wanted before we even went out there and looked for it. So if you're watching this and you're not looking for a job yet, but you think that you may be in the next few years, maybe it's time to start looking at what's out there. It's time to start evaluating what's important to you. How important is work-life balance? How important are your hours? How important is how much time you spend with your patients, your support staff? How important is it to have support from the physicians you're working with? How important is it to have administration hear your voice? And how important is it that you get stuck in a non-compete? And of course, salary. How important really is salary? So those are all the things you want to think about. If you're interviewing somewhere and maybe you haven't had as many interviews as you'd like, but this practice is, really seems like a wonderful place to work that will support you as a physician, that cares about you as a human being, and that want to hear what you have to say, well, maybe it's time to take the leap. I don't know. I definitely help doctors through that decision all the time. I help doctors find practices. I vet the practices that I work with, so I know that the practices I'm offering people will treat them well and will care about them. Um, and I'm happy to guide physicians through that as well. So if you're looking for a job, please contact me. I'd love to help you. And if you're not, well, just keep your eyes open, see what's out there so that when the perfect job comes along, you can make your impulse buy and just jump into it head first or feet first. I think that's the saying. Jump into it feet first and just know if you're wrong, that's okay. Then you pivot. That's okay. We don't have to be perfect. I'm Dr. Hochman, the medical matchmaker, and you can find me at www.happytohealth.co.